people still have their appendix? How many of you still have your appendix? Okay. Well, September 19, 2019, I had mine surgically removed. Today, I will first inform you about the appendix and its location and function. Secondly, we will go over the appendicitis and the symptoms and how it is diagnosed. And thirdly, we will go over the appendectomy and the two ways that the appendectomy is performed. Okay. The appendix is located at the end of the colon where the large intestine and the small intestine meet. Okay. Scientists still today do not know the real function of the appendix, but it is still an ongoing battle. Some scientists say that it is that it stores good bacteria in your body. But Professor Bill Parker goes on to say in the ABC article, even though these new findings may be true, we should still not hang on to our appendices at all costs. Now that we have established the function of the appendix and the location, we will now talk about appendicitis and how it is diagnosed. Appendicitis is when the appendix is inflamed. J.B. Pertowski and many of the colleagues notate in the Northwestern publication that appendicitis is a common condition occurring in 250,000 patients every year in the United States. Appendicitis. The symptoms of appendicitis could be loss of appetite, upset stomach, fever, and severe pain in the right part of your belly. And it is diagnosed by a medical history questionnaire where your doctor will come into the room and ask you questions like about alcohol and tobacco intake, allergies, and past medical conditions in your family. A physical exam is also given. It's when you have blood pressure, when you get your blood pressure and your breathing, your temperature, and pulse rate. Imaging tests, the MRI and ultrasound are also performed, and laboratory tests such as urine and blood are also performed. Now that we have established the location and the function of the appendix, and also the appendicitis and the symptoms and how it's diagnosed, we will now go over how the appendectomy is performed. There's two ways that the appendectomy is performed. The appendectomy is performed laparoscopically, where the doctor will perform 3 incisions in your belly, one on the belly button, one beneath the belly button, and one on the side. And it leaves three small incisions, whereas an open appendectomy is when the appendix ruptures. And when the appendix ruptures, it sends bacteria throughout the body, and that's more invasive. So when the appendix ruptures, they have to put a more deeper incision on the abdomen. Laparoscopic appendectomy is used in most cases, where in mine, and I'm sure it's yours too, when it's acute appendicitis. There's 2 types of appendicitis. There's acute and there's chronic. The surgeon uses a cannula narrow tube-like instrument to enter the abdomen, and according to the stage patient information, he goes on to say that surgeons watch an enlarged image of the patient's internal organs. And how they have a better view of that, I had to ask my doctor. He said what he did is in the first incision, he inserted carbon monoxide where it blows your stomach up, so where whenever the camera goes in, they can see your organs without obstruction. According to the Cochrane Library, an open appendectomy's incision is 5 centimeters long. In a laparoscopic, it is very small, it's about a ½ inch. Today, my purpose has been to inform you about appendicitis, its function, and its location. And also, the appendix, appendicitis and its symptoms and diagnosis, and the 2 ways that an appendectomy is performed. How many people today will go to the doctor and not chalk up their symptoms up to being upset stomach and to avoid having an open appendectomy? All